Hi, my name is Lydia. Today I was talking to you about the social determinants of health and how they can have an impact on a health condition. So there are six health social determinants. I have them written on the board, so we're going to go over them. So we have economic stability, neighborhood and physical environment, food security, community and social context, healthcare access and quality, and education access and quality. So economic stability refers to the security and ability to meet basic needs. Neighborhood and physical environment refers to the physical environment where people live and work. Food security refers to the access of safe, affordable, and nutritious foods. Community and social context refers to the community and social factors that affect health. Healthcare access and quality refers to the availability, affordability, and quality of care. Education access and quality refers to the level and quality of education a person receives. So in terms of involving this with the health condition, I personally chose hypertension. So we're going to start with financial insecurity. So with financial insecurity, a person does not have enough money, so they might not be able to afford to make appointments or pay for their medications because they're trying to allocate that money to other priorities. For neighborhood, it might just mean that this person does not have access to sidewalks, to recreational areas, to gyms, or they just might not feel overall safe in their neighborhood, which could impact their ability to engage in physical exercise. For education, they might have a lower literacy level, or might have a lower knowledge level regarding their condition, which can impact their life choices, dietary restrictions, and ability to know on how to treat their conditions, such as like monitoring and tracking their blood pressure. For food security, it could just mean that this person can either live in a food swamp or a food desert, which can impact their ability to be able to afford or have access to healthy foods. Healthcare access, this person might live in a place where healthcare is not very accessible or does not have a lot of providers available, which can impact their ability to receive healthcare. And for community and social, it might just mean that this person, there could be certain norms and attitudes towards medication and food, which might lead this person to not take their medication or follow dietary guidelines. So for the clinical outcome, we can see for hypertension, we can see medication adherence. They might not have a transportation available, or they might not be able to take their meds and go to their appointments, which could affect early delayed diagnosis, which can translate to poor disease management. For chronic stress, maybe they can't lower their stress because of their environment where they live, which is something they can't really control. Chronic stress can lead to increase of blood pressure. It can also translate into other diseases as well. For health literacy and self-management, it could mean that they don't know really how to take care or manage their disease, such as not knowing how to track blood pressure, or that could translate into something else. And then for follow-up and preventative care, if they don't have transportation or they don't have money, they're not able to receive care, which might lead to other conditions and poor management of their disease. Thank you.